Is that enough?
Sorry, those, I
What would you like? Some of the chickpea curry? It's plantain and chickpea with spinach.
Wow.
Wow, okay, that's going to be tasty.
Anything
I
else?
wish I'd had some.
Curry go?
Yes,
Have a taste of everything because you'll enjoy it. I am biased because my sister made it.
Can I try a little bit of that?
Yeah.
That spinach, sorry. Chickpea, spinach, and
Plantain curry. Got enough?
thank you.
Is there anything I can do? That's spinach rice.
Please,
Eh?
I love this as a macaroni.
You can make as many videos
No.
as you want. Never need to pick up a camera or use any fancy editing software. With doodling, you drag, you drop, you tweak some cells.
Oh, well.
What's the longest you've been away from Counselling?
I think it's me nipping into Lidl's quickly, washing up. Yes. But when she was the baby, so
Don't let me have to tell you that. Come in. That one's spinach rice and that's rice and peas, but she left it too late. And then she lost her confidence and I'm just like, she would have done alright. But she's ready now. I will. Because she forgot to, I told her to bring really to...
Can I have some of that?
The curry chicken, of course. Sorry, I can't find it. We haven't got any decent spoons, so I'm having to make do. I'm having to... What would you like?
oh, okay.
What else? Anything? One of the chicken thing. The breast or the supporters. This one. This.
Yes.
That's spinach rice.
Okay.
And that's rice and peas.
That's
That's all in there too.
That was it. Oh.
So just the
Better be good. We better look good, eh? Yeah.
Jerk chicken, but it's the breast.
oh, okay.
So you've got like jerk chicken breast and
I know we know everybody, but it's just nice to see everybody again. It's been so long. So thank you everyone for coming. I thought, just before I start, I just want to say, this is for Major, this is for you, Major. Major is so dedicated, so committed. Every time we have a function, who do we see? Every single time we see Major. So I just want to just to pay some tribute to Major. Major's had a little bit of bad news, and we just want to say, you know, we're thinking of you. You're so amazing, and we just want to support in whatever way we can. Major lost his dad. Was it this week?
Yeah, Wednesday.
On Wednesday. And look how committed he's here. And I just, Major, thank you so much. We're here to support you. Okay, so I just wanted to start by saying that. So, thank you everybody for coming. I think it would be really good just if we could just say who we are, because there are a couple of people who you might not know. So everybody knows I'm Faye Bruce, I chair CAHN. I'm going to go to you, Diaz.
Okay. My name is Udias as well. You want me to stand up? Or?
No, it's fine. You're fine. You're fine.
For the camera.
And get your lips out.
Okay. My name is Udias Aswalame. I'm a nurse case manager with
Manchester local care organisation. Yeah. Yes, and I volunteer. I'm one of the volunteers.
How long have you been with CAHN for, Vivian?
Oh, wow. How long? You tell me.
Since inception.
Yes.
We're 5 years
Anyway,
old this year as well.
You've got your
5
time.
years.
You've got your time.
Yeah,
You tell
5
us.
years. Yes.
Yes.
Yeah, and I enjoy it. Nice see, meeting you all.
Thank you, June.
Yeah, well, I'm up. So I'm June Green, and I'm now retired from the NHS, and then 3 weeks after retirement I started working for CAHN, but I've also been here from the beginning, haven't we? First Windrush we did screening, and they haven't been able to get rid of me since. I just really enjoy working for them, and so now I'm working for them post-retirement, like 3 days a week. Well, it's supposed to be 3 days. But I've been told I need to be. I'm flexible, so and it's amazing. It really is. So it's just a really good organisation to work for. Thank you.
I'm Larinty Fletchman-Thompson, and I'm Head of Education and Learning for CAHN. I did used to be a nurse volunteer, and I was working as a practice education facilitator when I developed CAHN into a learning environment as well. So we have student nurses that work with us at CAHN. And I'm really enjoying my job. I love working with CAHN. I love all the volunteering that I've done previously as a volunteer nurse. I love the galas that we've been to as well. It's fantastic. It's great to see you all today.
I will not be standing up.
I'm only on page. Have you got such a beautiful dress on?
Just even place. Go
I'm Paula. I've been here volunteering 4 years now. Not done much recently because I've not been very well. Always enjoyed being a volunteer here. My background is mental health nursing. I'm in the process of setting up my own mental health project, and I've just been awarded some funding. Yay! So I'm really excited to do my first project. So yeah, I'm back on the track now. So hopefully I'll be involved a little bit more. Yeah. Okay.
Hi everybody, I'm Tembi Moyo. I'm the multi-professional lead for CAHN, and I've been with CAHN for almost 5 years now, since the volunteering for healthcare professionals started. And I've been working with all of you who've been working with CAHN as well, and I've been enjoying it. So I'm looking forward to be working with you, and you bringing others on board as well, so that the workload will be a little bit lighter for everyone.
I'm Vanessa Bryan. I'm a matron at Manchester Foundation Trust. In trauma and orthopaedics, I've been with CAHN from the beginning, inception, everything else.
Great. Thank you. Alessandra.
Hiya. I'm not going to stand up.
No, fine.
Go and shy now. Yeah, so I'm Alessandra. Work within Shaw Hospital as a cardiothoracic ICU nurse. Currently on maternity leave though, so. But yeah, that's me. Met Faye when I opted for my MSc, but didn't continue with it due to maternity. But maybe in the future we'll get back to global health nursing. Yeah, that's me.
Thank you.
Hi, my name is Sulika. I'm a ward manager at Manchester Infirmary in an acute surgical ward. I've just joined CAHN. I'm looking forward to doing so many things more in CAHN.
You can bring your brother on board as well. He's on one of my wards.
Hi everyone, my name is Chamaka. I work in the vascular unit. I'm training as an advanced clinical practitioner. I think I've joined CAHN for a bit. I'm one of the mentors for their students.
Thank you. Welcome.
Yes, I was.
Yeah, that's right.
Hi everyone, my name is Esnat. I met Faye through a mutual friend. I think I joined CAHN in 2019. Not been able to do too much or as much as I'd like recently because I've got a little one, but now at the stage where I'm hoping to get much more involved. I'm a pharmacist by background and I work at Tameside Hospital and teach at the University of Manchester.
Hi, I'm Julie Lee. I'm a neighbourhood lead, work for the local care organisation, and I also am one of the Northwest Regional Leads for the Chief Nursing Officer Black and Minority Ethnic Strategic Advisory Group, and kind of like an unruly group at MFT and Friends. I think we kind of do things. I've been part of CAHN when pretty much I met Charles for a cuppa and had a discussion about Windrush, and then it just ran away with itself from my perspective, but it ended up, and I do recall trying to get June to be the chair of that meeting, and she wouldn't, and I kept trying, and but yeah, we and it's just amazing where it's gone to, really, and yeah, so it's a great organisation to be part of, really. Excellent.
Thank you. And can you leave you from it just the right time? If you just introduce yourself, what you do.
Oh, my name is Anwuleka. I'm a specialist health visitor and lead for perinatal and infant mental health. I'm based in Manchester local care organisation, and then part of MFT.
Wonderful, thank you everyone. So before I invite Tembi, just to give us a little bit about the multi-professional group, I think most people know about CAHN. We've been here now, well, we established 2017, July 2017, so we are 5 years old this year. And we're I would say quite a big organisation, probably one of the largest organisations, certainly black-led organisations in Greater Manchester, but also we're national now. So we have left Manchester, well, we've kind of built on Manchester, and we have a number of models across England. So we are in London, Enfield, we're in Haringey, we are establishing in Nottingham, we're establishing ourselves in Birmingham and in Lancashire. So all of that's happening as we speak. We are 45 members of staff now, so we have grown that much. In the last, I would say, probably since 2020, we've just been growing and growing. But like many people have said, when we started, it was really myself, there was Charles, there was Gilly, Udius, there were Vanessa, Tembi, all helping volunteering to try to establish CAHN to what it is. So we've got lots and lots of different areas of work. We do lots of community engagement. We have health and well-being. We have a counselling service as well. So it's a black-led counselling service which we have had hundreds of people through in the last 18 months. It's just been incredibly busy. And you know, there is so many things that are going on, and I don't want to kind of go, our website is www.cahn.org.uk if anybody wants to have a look. But I think most importantly for me, and somebody mentioned it, I think it was Larinti, the great things are the galas. It's always the gala.
You get to dress
It's just incredible, yes. So every year in October for Black History Month, so we open Black History Month for the whole of Greater Manchester at Manchester Cathedral. So we do it at the end of September, and from there lots of different activities will happen. But then in October we have our gala. We have our huge gala. So the one that we did 2018, it's an awards gala as well. I think we had about 600 people at that one. The one in 2019, I think it was a little bit less because the Etihad couldn't hold anymore, so we had a few less. And this year, we're at the Hilton. So we are stepping up all the time. So we're at the Hilton, October the 22nd. So just another opportunity for us to all get dressed up and have lots of photographs. So there's that. But yeah, I mean, there's lots of really great things happening. I've just chaired the National Black CVD Advisory Group, which my PhD started all around CVD, because I keep saying CVD is emblematic of a health inequality. It is really, you can hang so many things onto that. And so when the opportunity came to start this National Black CVD Advisory Group, we've had Kevin Fenton on it, we've had, you know, Shahed Ahmed, if you know any of these people. We've had some really big influential people in this group, as part of this group, and really what we're trying to do is champion CVD. We need some kind of national kind of initiatives for our communities, because it's so bad in our community. So, you know, there's so many things going, and I can't even start to name too many of them, because it is very, very busy. And I'm sure Larinti and June would tell you, working in CAHN is not, it's not a 3-day week for you, is it, or a 2-day week? It's
when you need it.
It's yeah, whenever
a name just pops up.
Yeah, and we talk about how we're a flexible organisation, aren't we? we have flexibility from our staff as well. We do health hours as well every Saturday. We do health hours. We have consultants. We have GPs. We have surgeons. We have people talking to our communities about what they can do to improve their health. So all of that is it's just really, really important for our community. So that's where it started. It started with community. It started having conversations with community about what they felt was needed, and this is what we're doing. We're responding to their needs. So that's why, you know, I'm really, really passionate about what we do. So I just thought there was a little treat I just wanted to give to you all just before I'm going to invite Tembi. So Major, if you can go and ask them to come through. It's probably going to need you to get up and do some stuff. Yeah, it was just because I just thought, we've been locked behind screens, haven't we? We've all been, you know, on Zoom and Teams and stuff. And when we get out, we just need to be able to get out and do something and move with each other. So we've got this little, just 2 people coming to do some dancing. So, whenever they're ready. Right, so I'm going to go and sit down. Because I'm not...
All right.
Yeah, Major's going to do some...
Salibonani, salibonani bokokoloma, salibonani bokokoloma, salibonani, salibonani, salibonani bokokoloma, salibonani, salibonani,
Thank you.
delightful to be here as well. We come from Bulawayo, Zimbabwe, by the way. And we do traditional dance for a living, and it's a passion. It started as a passion, but it became a career as we started touring the world. So we love it. So we hope you guys are going to love it as we love it. The next one is called Sis on My Head. Sis on my head, sis on my head, on my head, sis. Sis on my head, sis on my head, on my head, sis. Namhlanje kulamangam, kofikathi wothinza thela udokotela. On my head, sis. Sis on my head, sis on your shayika. Sis on my head, sis on your shayika. My agencies, namhlanje kulamangam, kofikathi wothinza udokotela. My agencies, siwuli isigqoko sami, siwuli isigqoko sami, siwuli isigqoko sami, siwuli isigqoko sami, siwuli. Wojikathika zinsizwa amadoda. Wawukhona, everybody. Wawukhona, sawubamba thina.
Chiga, zinsizwa zakithi.
Wawukhona,
la la, wawukhona, sawubamba thina.
Listen, thanks so much. Actually, we're a group of 8 people. We've got females in our band or in our group. Excuse my language because English happens to be our 7th language. So.
I'll translate.
Thank you so much, sister. Thank you so much. So maybe in the near future, in the near future, that's what it's called. In the near future, the girls are going to be here as well, and then all the group is going to be here.
Anyway, you brought this point. Anyway, do you want to be part of the show right now? Yeah, you can be. Just where you are, you can sing whatever. I sing back to me.
Let's do that.
I'll teach you a song that you're gonna sing back to me. It's a very important song back home in Africa. It was sang by the lady called Miriam Makeba. It's very easy. Yeah, you say oh ham.
Oh ham.
Just talk it. Oh ham. Yes, me, I believe that if you can walk, you can dance. If you can talk, you can sing.
Simply.
Oham. Okay, now we put it in the song kind of structure. Oham. Is it down? Oham. Let's go. Oham. Come near you. The rhythm. It's a pity because we are just here for a little bit, but next time is going to be a killer. Promise. Thank you so much.
Thank you very much, Faye, for organizing this dancing group. You know, they actually come from where my husband comes from, and they speak the same language with my husband. So I could hear everything which they were saying when
So
they
you
were
tell
saying.
us what it means. What were we singing?
I'm trying to go where our program is. I know we are running late on our program, but it doesn't matter because we are all fed, we are all watered, and we've all had our desserts, isn't it? And I don't think there's any one of us who's rushing to go for a shift, isn't it?
Not for sure.
Yeah. Anyway, thanks very much everybody for coming in and joining us today on our launch day. And it's just what Faye, I'm just reiterating what Faye has just said about CAHN and our programs. And I can actually say in brief that those volunteers who started right at the beginning together, we are all here anyway. So this is the reason why we need you guys to be on board, and then we can work together. The evidence is there. Do you not want to be part of that, surely? And you can actually see the good works which we have been doing. And you know, sometimes when you're doing it, you would not know how much you have done. And sometimes when we are actually talking amongst ourselves, we say, oh my goodness, look at all those events. And I was laughing with them here, saying there are 4 faces there, which are actually like appearing on each and every picture. We need to have a variety and to have different faces as from now going to the future. And we are there to be supporting all those of you who are actually joining us now. So I don't want to take much of your time. I want to call all the old volunteers just to give us their experience
with CAHN, how they've been seeing CAHN and their experience. I know they've just been saying it during their introductions as well, so it's going to be a brief one, isn't it? So we're going to start with, I think I put SNAT on the program, and I was trying to go on the program which we drafted.
Yeah, SNAT.
Yeah, so SNAT, if you can give us your experience with CAHN.
Okay. So sorry, no, not moving, not standing. I started with CAHN, as I said, around 2019. And my background is in pharmacy, so I'm a pharmacist, and my role has been to share where I can about people's relationship with their medicines and giving advice in that area. I found it eye-opening. I've also found it something that I wish I had been able to do a long time ago. And so I think if this is an opportunity that you can get involved with, definitely get involved with it. It's been valuable. I'm hoping to do more. And I think it's something that our community desperately needs.
Okay, thank you very much. Are you done?
I'm done.
Okay, the next one is Paula.
What can I say? I love CAHN, put it that way. I love everything they stand for. I enjoy spreading the word about CAHN. I've been very lucky to volunteer on both galas, Windrush Day. My furthest journey was Haydock when Charles rang me out of the blue. Paula, somebody's dropped out, can you go to Haydock? I had no idea what I was doing. I didn't know what I was going for, but I went because that's how much I love supporting CAHN. Like I said, I've not really been doing much, obviously because we had the lockdown and the pandemic, and I've not been very well myself, but I can just say if you can get involved, whether it's general nursing, mental health, teaching, anything, try and get involved. It is giving up your time, but it's worth it at the end of the day. CAHN has made a big difference to the lives of black people in Greater Manchester and now beyond. And I think, yeah, it's a great venture to be involved in, and it's only pluses all the way. So if you can give some time, please do. Yeah.
Okay, thank you, Paula. And we go to Jilly.
I will stand, if that's all right. I've written a speech, if everyone's happy with that.
That will be a 3-minute speech.
Yeah, that's my speech, true to form, a bit of mind map. But there is a couple of things I'd just like to say. So I was really pleased to hear that you were taking forward this group, because I know how tenacious and committed that Tembi is, and what I've seen as Rachel as well. So thank you so much for doing that. That is just fantastic, because it does need that leadership, doesn't it, and bringing people along. So I wanted to say I was grateful. There's a couple of things I wanted to just share that with people that might not have been aware. So I've already said about our cuppa. I think it was hot chocolate, actually, Charles, when we first met. I had to pay for it. I remember that. Oh, no, I offered to pay for it. So, and absolutely well worth the £2.50 it was in Costa or whatever. But, you know, that is symbolic, really. Went on to do the Windrush Festival, which really CAHN just took and run with. And, you know, we got funding for that from all different organisations, and the first one being the police. They were just hurrying to give you some funding. And I think why I'm mentioning that is because we know that health and well-being is beyond just what we're doing. So I was really pleased about the MDT part of it. But I think it's also symbolic of how CAHN's seen within Greater Manchester and beyond, and by different agencies. And I think the other thing for me is we all work in different styles. So, you know, that being self-determined and having that emergent design is really important to me. And I don't know how many of you stay awake at night thinking about what's the vision for our future. But I think if we're looking beyond, we need people in different parts of the system. And we also need, you know, the vision to take us, you know, taking care of our own health and well-being. I think that's what this does. So I'm happy to be in the part of system I'm at, supporting CAHN when I can and being part of it. So that's what I wanted to say, really. So yeah, thank you, CAHN, and thanks to Tembe for taking it forward. So that's mine.
Thank you. Right, our next speaker is Scholar. I think she's eating. Let's just leave it now. Because I know I've asked her to take some food. Udias, and after Udias, Vanessa.
Yes, so my experience, I've been asked to talk about my experience, with working with CAHN and the screening and so forth. So, I started with CAHN about nearly 5 years ago, since about its inception. And it's really been, an opportunity, a privilege, really, to work with CAHN. I'm passionate about addressing health inequalities, and that's the ethos of the group. So, I'm passionate about everything they do. So, working with CAHN and doing the screening, it's been an opportunity to see not only for, reducing health inequalities, working one-on-one with the public, when they come, and also it's an opportunity even for health education, health promotion. So for it, and we've had so many people we've, pick things up on, and they've, their, trajectory in terms of, bad health has been, diverted, and intercepted for good. So, for example, we met I met a gentleman again at the last Windrush, and he said, the first time he knew he had any health issue, his blood pressure was sky high, was when the previous Windrush, it was picked up. We gave him health education and also referred him to his GP. He went on medication and he came back. Look, when I saw him again a few weeks ago, he looked healthier. He'd lost a bit of weight and all that. And when I checked his blood pressure, it was normal. So, we changed, and he was so grateful that we've changed his life. We've changed his lifestyle. So those are the things that makes me happy. You get health, you get satisfaction, job satisfaction, everything, is ticked. With that, and then, working with, great people, developing friendships as well. It's, those are highlights for me, and, it's a privilege working with CAHN. So I hope other people will come on board as well.
Okay, thank you. At MRI. I joined MRI in 2018, and then CAHN came along. I embraced it because it was really important, black health. I champion our people, and I think it's really, really important that we know about our bodies. We're quite a unique race. We've got all sorts going for us, but we just need to champion our own health. CVD is an issue for black health, prostate cancer, all these other things, and we just don't know. And I think for us, we need to be leaders in our own health, male, female, young. And on one story I can tell you is on one of the health screenings, there was this fit-looking young lad, 15 years old, rugby player, did his blood pressure, didn't expect a problem. There was. I thought it was my machine, so I changed it. It wasn't, so I passed it to June. She got the same result. That young lad, when we went to his parents, told him, we insisted that he got taken to the doctors. He went, he was under-sulphured, and he's being treated. He could have been a sportsman on the field who collapsed and died. And this is what CAHN's about. This is what we need to keep championing, and this is why we need to bring new people on board. like I said, I've got Aleka's brother on my ward, and I'll be working with him as a nurse to bring him along. Don't tell him yet, though. But this is what CAHN's about. We've got to keep going. COVID has caused an hiatus. That's over now. Let's go back to it. Okay. That's all I've got to say.
Thank you very much, Vanessa. Thank you very much, everybody, for contributing. So now, Scholar, I think you've just had your food. Before we proceed.
Hi, everyone. I'm Scholar. I'm a nurse, a practice development nurse in Salford Royal. I've been with CAHN right from the beginning. I remember the days, Vanessa, I can remember when we were sitting down drafting what we wanted CAHN to look like and, you know, what we were going to bring in. And the reason why I'm passionate about volunteering for CAHN is CAHN makes the difference. You know, when CAHN was starting to talk to people, we were like, okay, what's this about Health Network? I can recall a number of sessions where we've gone out in community and screened people. One of the occasions I can remember we were with Tembi, and there was a function where people were coming to eat, drink, and be merry. And this lady's blood pressure was over 200, and it was like so high. I looked at her and I thought, are you okay? And I said, have you taken your tablets? She says, oh no, I haven't taken them. I normally take them. I can't remember the story that she gave us. I said, you know, you're from Wythenshawe and you're here in Manchester. You need to go back and take your tablets. She actually went back home, took her tablets and came back. Well, I can remember the number of times we found people who were walking around like a time bomb, quite ill, people who didn't know that they're having AF and their hearts, they're like saying they didn't know why they're feeling unwell. And why this is important for us is there's a lot of evidence showing that we are the people, we understand our people, the health inequalities. People are looking for that friendly face who looks like them to say, come, let's help you, let's direct you. Because there are some questions that people are even afraid to ask because they think they will be judged. You know, how do I ask this? And being with this group, what's nice is that sometimes people can actually come and say, well, you're more or less of the same age. Do you experience the same thing? So CAHN is creating opportunities in terms of people finding a safe space to ask questions, you know, being challenged when people come and say, I've been to the GP a few times, and we are saying, go and get your tablets reviewed. You know, we're picking up a lot of things. So CAHN really is good in the sense that we are finding different people. And the functions we hold, we have a lot of these active, you know, the Saturday hour, for example, people are learning a lot from that. And we are, being a member, we are able to recruit people and say, right, I'm with CAHN. This is not just like any other, you know, junk mail, go and attend, you know, and we are seeing the difference, especially that there's also other people like mental health nurses. Hence, I brought my sister today who's never been here. She's a mental health nurse. And I said, we need you in CAHN because we want to cover all sections. Thank you.
Thank you. Thank you very much, everyone, for your contributions and your sharing your experience with CAHN. I'm going to touch briefly anyway. We know exactly what CAHN has been doing and how it has been engaging with the public. And I just need to share with you my experience with CAHN as well. Personally, I am glad you touched about the 1 hour Saturday health hour. Myself, I'm a Seventh-day Adventist. I don't participate a lot in things on a Saturday because that's my day I go to church. Today I just agreed to come because I believe in promoting health. And this morning we had a health emphasis day at our church. We had David Williams who has been presenting. I'm actually regretting why I didn't invite you guys because he was presenting about racism and health, how the two are linked. It wasn't about preaching the Bible. It was just saying the facts as they are, that racism can affect our health. And I know all of us, we are maybe 3/4 of us, and maybe we might have 1 or 2 who are not in the BME group as well, which is a group which is very supportive for the BME and healthcare professionals. It's not about nurses only. So the reason why I'm saying this is can always share information. If you are not able to engage for whatever reason, be it your belief, be it whatever other reasons, you are not able or capable to participate in anything, you can always share. We've got our WhatsApp groups, our other platforms where we share information. I remember telling Faye the other day that there was a presentation which was made, I can't remember what topic it was, I think it was diabetes. And I've got a nice feedback from one of the person in the group which I am with. Said, Tembi, you know what? I'm so grateful you share with this healthy hour with us. I share it on a Friday to that group because Saturday I'm very busy anyway. I wouldn't be able to be sharing information for them to see on time. So I didn't realize that there's somebody who's actually watching regularly, and it's not just somebody. There are actually quite a few people and who are watching these programs on a Saturday, which I'm not even watching myself. And then when I get those feedback, do you know what I do? I go on YouTube now and start watching what was being presented because I wouldn't know what they were talking about, and then what they are commenting about and what they are thankful about as well. So there are so many ways which we can help out and to reach out our community, to reach out our public. And then we've got current programs which are already running, and we've got some which have been done before. We did the vaccinations. I'm not quite sure whether that is going to happen again. And then we were actually doing health screenings. With health screenings, I know Laurenti there, she's going to talk more about them because we're just allocating ourselves jobs, because within a team and an organization, one person cannot do everything. That's why we need everybody to be part of CAHN, the new volunteers and the old volunteers. And then with the new ones, just feel very reassured that you've got a team which has already started. And we know and understand where things need to change and how we can actually make things better for us to be functioning out there. Because we are the team which is actually going out to do the health screenings. I know we've got the medics as well who are working for CAHN and who are doing these presentations, but we are totally different with the medics, because the medics, they're actually presenting online and they're presenting their specialist area. And then this is the area which we are saying that if we actually review ourselves and with our area of specialist or specialism, we can also be part of the panel of that presentation which is happening. Those who are able to join in on a Saturday, whoever posts questions in the chat, you can be part of the panel who can be responding to that, helping out the person who's presenting. It's actually a good help as well for them. They need that help. But then if we don't come together as a team to do that, it will not be able to happen. So this is the reason why we are launching or having this launch, so that we can identify ourselves, identify our area of specialists, and then we can actually support what's currently happening. I know we've got some few programs which has been commissioned, Faye and Charles and all the others who are in the CAHN organization, because I'm actually volunteering. I'm not like employed with CAHN. So I leave that for them to be presenting to us if we've got any other programs coming in. So Faye, can you just give us a brief overview of programs which have been commissioned or which have been confirmed, so that people will know exactly what programs are coming in the future. And then Laurenti can present our screenings, because with our screenings, bear with us, we just get them randomly. You can get them on a Monday, say, oh, on Sunday, this church has requested to be screened. We can't say no, isn't it? It's CAHN. But then I know we are pressured and it's short notice, and we've got people who've got pre-booked plans already. And like myself, Sunday is the day which I can actually like maneuver things. On a Saturday, I will not compromise. Today, I've just agreed to come because it's part of health, and that's what I believe in, even in my church. I do promote health as well, and this is part of health, so that's the reason why I'm here. So, Faye, if you can give us the future program.
To remember what it stands for, called CAHN, Knowledge,
Assess screening for improved health.
That's it, yes. So that's a programme that's based in Salford. Started probably a good few months ago now. And what we're trying to do in Salford is improve CVD knowledge across that population group. So we have recruited 10 ambassadors from communities, from churches, to basically be educated around CVD so that they can, I suppose, educate the community, their congregants as well. So we, like Tembi has just said, we can't always be everywhere. So what we need to do is have our congregations health literate. So that's something that's happening now. And just whilst I remember, I just want to, every time I see Vanessa, I just keep thinking about all the screening, because most of you are always there. We screened over 500 people when we pre-pandemic, and we referred over 50% to GPs. That's just phenomenal. So so what we decided to do in Salford was to focus on CVD, and so what we're going to be doing to complement that, to support the ambassadors, is to go out to those churches, go out to those community groups, and do some screening there as well. So June, you've been out to one group already, which is the Salford Leaders Group, and done some screening with them, talked about a little bit around CVD, and what I'm doing at the moment is putting a CVD training pack together. So if anybody wants to help me with that, or if anybody's got anything that they can plagiarise and we can kind of take bits from that, then that would be really, really helpful. So that's where we are with CAHN, and we do have dates, and what we are trying to do much, much better is give people plenty of notice about screening, because we know everybody's incredibly busy. And so what I've said to the team at CAHN is, don't commit us to anything until we have people that are available to do it. So that's been my thing to the team. So we have some dates already. I think we've got some kind of real futuristic dates. Lorinta, you might be able to give us some dates. Yeah. And then we have a number of different things that are going on. So of course we'll have our Black History Month, where every time we screen at that. So that's going to be at the end of September. And where else are we screening, Charles? Anywhere else? I think that's it. That's all I know about anyway at the moment in terms of programmes where we'll be doing screening. But right across Salford, we need to screen 500 people. So we will have a lot more help. So you may know that I run a Masters in Public Health. We have lots of doctors, lots of nurses on there. They came and helped us last time. So we'll be getting, people like that have volunteered to come and support. But we're just trying to build our teams. I did say it'd be good to have a screening team. People where they're, really committed, but a significantly, sized team, so we could spread the load amongst that team as well. But we do have a lot of screening to do in Salford. I think one of the things we talked about was how far we go. So we do blood pressures, we do AF, we do, oxygen, and do we want to go any further in terms of that screening? But that's a conversation that we can have later on. Those are the only programmes that I know about. I don't know if there's anything else. Is that it, Charles?
Yeah, so Tembi, do I speak now?
Or Lorinta, you can give...
Programs which which every commission, but I need the volunteers to
signed up to, we've been asked by Carnival Manchester to be involved in the massive event. There are thousands and thousands. We will have a health space. We'll have a big health marquee on that day, and so we'll be screening there as well. And I don't think I'll be bringing you into the maternity one, so we can leave that one for now. But that's all I know about for now. But Lorinta, if you can tell us the dates for the ones that we know about.
Yeah, I think we need a team and a lead as well. We need someone to lead on it, because even at the Windrush event, someone was asking if we could do some at their church. So I was saying to speak to Charles, because as well as Salford, we're being asked to screen in other churches. and other places, and it just keeps coming, you know, and sometimes it is short notice. It's like, oh, can you do next week and whatever. So there is the demand, and in one church I think we screened about 36 people at the end, and that was, you know, that was just at the end of the service. So a lot of the services are from 10 till 1, and it's just at the end where we do the screening, and just need to say a little bit about CAHN just before that as well. So at the minute, the next one is on Sunday the 17th of July, which is next Sunday, and the service is 10 till 1, and it's just after the service that we need to do the screening and say a little bit about CAHN in between. And that is the RCCG Full Life Christian Centre. I don't know if anyone knows it, and that's 49 Melbourne Road, Middleton. So that's where our next health screening request is. And then after that, it's one at the Manchester Carnival, Alexandra Park, and that's over 2 days. It's Saturday the 13th of August and Sunday the 14th of August, and we'll be doing screening on both days. And as a learning environment, our student nurses helped with the screening as well, and they absolutely loved it when they did it. There's 2 of them. It was really funny. I think they were saying that, because you know, we sort of supervise them because we've got practice assessors as well. You know, and they love doing the placement with CAHN. And one student nurse was allocated somewhere else and actually asked to come to CAHN, which was great. And it was somebody that had been on placement with CAHN that had said to her colleague, no, stick with CAHN. We've got a final placement student nurse with us at the minute, and our capacity is 3, and we're hoping to increase our capacity, but we will need some more assessors for that. So if you're interested, please get in touch with me. I'll support you with the SSSA and the PAR and everything. I do all that training, and I support you, you know, getting up and running. And while you've got a student as well, but they absolutely love it, and they were doing the screening as well. And I think they said to one of you, you know, are you sure? I think we could pop into the toilet, and I think you said to you that, are you going to be all right while I've gone? Is that student?
Yeah, I'll be all right.
I said 2 student nurses, because they were like doing it together. Because we've got like a sheet for them to sort of follow and ask the questions, and then as registrants we complete the slips to give to people, and I think they were both going to the bathroom. They said to you, will you be all right until I come back? The 2 students were funny, but they absolutely loved it. They really do. So we are doing really well as a learning environment. But yeah, screening, it's a great experience. I love it. You know, the feeling you get speaking to people. At the Windrush, my mum even came, and my sister, and was like, oh, you know, and the student nurses did theirs. It was lovely. But you know, it's great, and people really do appreciate it. And there's obviously a need because we keep getting asked, and there's loads and loads more. So it would be great if you can. It's only a couple of hours. It's not like the whole day. You know, it's just being there for the screening bit, which is usually you know, about 2 hours of your time if it's a Sunday or a Saturday. And what I did with the Windrush, because you know, we sort of allocated 2-hour slots for people, so you just came for your 2 hours, and I'm usually there like the whole day, just sort of supporting. But if we had a lead that would help to organise, you know, as we see screening requests come through, and to then, you know, contact everyone and just organise it, because at the minute I sort of try and lead up and sort of do it all together, don't we? You know, but it would be great if we could have it organised with a team, and it could flow a lot easier and give people as much notice as possible to keep it running. Yeah, so that's it. So the main ones are next Sunday, so please let me know if anyone's free for a couple of hours. It would be great. We tend to need about 4 people, really, to get up and running, and you know, once it's done, then that's it. And we also need someone to gather the data and put it together as well on a spreadsheet or something. And we've got all the equipment. I've just sort of, you know, done a list of the equipment we've got. Someone did ask if we were going to do blood glucose monitoring as well, but I don't know. I said I'd ask about it, but it's something we need to discuss.
Yeah, we talked about it ages at first, didn't we, whether we're going to do that, but you start messing with bodily fluids.
Yeah, exactly. Yeah, it's a different thing. I don't know if there's
shops
anywhere around it. Yeah. Well, there's loads of questions, and people are asking, are we going to be doing this and that and whatever. So I think it's discussions we can have to make it work a bit easy and get all that data there, which I think is it's amazing data, and it's an eye opener. You know, you check people's blood pressure. One lady's I checked, she said she I think she had a blood pressure checked somewhere before. It might have been at a pharmacy or somewhere, and she wasn't able to get hold of a GP because she was new to the area. So a relative from abroad was sending her blood pressure tablets, which she was taking, and she wasn't really sure whether it was working or not, and then checked her blood pressure and said, no, it's not working. I said, you need to go to your GP. So when I wrote this slip out for her, I said, give this to your receptionist and tell her that you need to see a doctor, and give that to the doctor, and then they will listen to you, because she felt the receptionist wasn't listening to her. Every time she went to get an appointment, she felt like she was just giving excuses all the time. But she says, that's great, I've got this bit of paper, and I sort of put in big letters, she needs to see a doctor and what her blood pressure
And we usually just do our
readings were and
signature
everything.
at the end and put RGN, so they know
That's
that,
right.
you know, that it's somebody who, when you take it to them, they know that, well, you know, it wasn't just somebody gave it them off the street, it was a nurse, and so they do
That's
take it,
right.
hope to take it more seriously.
Yeah, because she had 2 little children as well, and she said she felt a bit better because she could actually show that to receptionists and to a doctor, and she could get, you know, get a foot in the door. You know what I mean? As opposed to just taking these, she wasn't sure what they were, but a relative that was taking blood pressure tablets sent that to her and said, you know, take those, they'll help. And she'd been taking that for ages, and she doesn't know whether it's working or not. But it wasn't, you know, and I said, no, I said, you need to see somebody properly. Yeah, so that's an example. So, you know, our people need our help, you know, and that's, I mean, and, you know, I love working for CAHN because I love working around, you know, black people. It's something I've, you know, not had the chance to do before through the whole of my nursing career, so it's amazing. Yeah, and I sort of came into CAHN as a volunteer nurse. I think it was when I met Jilly first when I started working at MFT. I didn't know anyone at MFT. About 6 years ago when I started working there in education, and then he invited me to a BME group meeting, and then just did loads and loads of things after that, as well as volunteering for CAHN. It's just great actually being, you know, being a member of staff and head of education since November, and I love it.
Can I just ask, have we thought about moving on to a CAHN health passport where you can capture lots of the programmes that we're doing, and it's got the CAHN logo, all the people that are supporting on the back, and you can have specific conversations with specific people, male, prostate, somebody raising a concern about a health thing, posing the right questions to go to a GP with. So you call it a CAHN health passport.
That's a really good idea.
Yeah.
That would work into the personalised care agenda. Absolutely would. Actually, Vanessa, and that is key at the moment for NABLE's PCN, the next phase of the work.
I just need to talk. Well, Larinti, you haven't even mentioned the fact that you showcased your student ambassador to the Chief Nurse of England. Just thought I'd mention that. And everything that we do, it's like it's a fluidity to it, isn't it? But, you know, that's, you know, it's all with the support of CAHN, with what we've done. But I mean, it's now being asked to be rolled out when you're ready. But that's, you know, the work that you're doing with students at local level at CAHN and then right to national. So, yeah.
Still doing that as well. Well done, GM. And they were saying, you know, how they felt they needed additional support and weren't getting there, and got ambassadors in the university but none in clinical practice. So I worked with got some meetings and things. We're able to roll that out. You were, yeah. So it is. It's, you know, it's out there, and we've just done a voiceover as well, where we've got students talking about their experiences, and that's being rolled out as well. I'll have to send it to you all. And one of our CAHN students, CAHN, is on that as well. His voice. So yeah. So. Yeah. Oh, thank you, Julie. I'm not very good at singing my own tunes. I'm just not like that. I'm sorry, but.
Not saying what you're doing. But I reckon, I don't know about whether I'm overstepping the mark here, saying
You want to progress. That's the hardest thing. But I think once they and Charles hear or have a sniff of what you might be interested in, then suddenly you'll be catapulted. But it's just that bit, just what is it that you want, you know, your bit, and then I feel that you get the whole organisation and things going on around you all the time, interested in what you want to do, really, I would suggest. I don't know if that's right, but I get that sense, really. Yeah.
some people, yeah.
Just realised she was
2017, yeah.
Yeah.
I think yours was, your title of your presentation was Catch Them Young, like early or something, wasn't it? There you have it.
Thanks very much, Lorinti. Let's carry on with our program here. I think some of the information, it will be just crossing over. I've got here our neighborhood leads allocation. Greater Manchester has got how many neighborhoods? 12. 13 now, isn't it? So
that's just the city of Manchester.
Say that again?
That's the city of Manchester.
That's the city of Manchester, yeah, not Greater Manchester, because Greater Manchester is a neighborhood on its own, isn't it? It's a locality. Yeah, it's just how to say it politically correct anyway. So each area we would require a lead. So on this one, can we put a time frame when we can allocate these leads? Because it will help if we know that who's covering Stockport area for CAHN, and who's covering Berry, who's covering Salford, who's covering Trafford, who's covering Central Manchester, who's covering Bolton. I'm trying to think of them, you know, as I'm talking. And who's covering Oldham, who's covering, what do we have? Wigan, yes, who's covering Altrincham and Trafford, they're the same. Trafford and Trafford, they're the same. And who's covering Withenshaw, who's covering North Manchester, those areas. So I know we cannot do that today at all because of time constraints. So if we can have some timeline, which we can say that we can actually revisit that, we'll be posting on the chat as well, just to jog people's memories, and then for those who are still interested in CAHN. I know there are some people who wait to action when they've seen things happening. And then for this launch, I know there's a lot of people who are not quite sure that whether they will come. I know people, they are committed with different reasons. And if I can tell you that when we were ringing people just to check whether they've been coming, I don't know how I can put it across, whether it's us as black people not to confirm things, or we just keep quiet. And when you want to plan, it's so difficult to plan. If I can tell you, we're just planning with 20. We just kept a number. Faye says, you know what, let's just keep the number to 20. And then we were actually saying, are we going to find 20 people? So we ended up ringing people, because those who have actually confirmed were 12 people. And amongst the 12, these are regular people who always come. So we wanted new people to come.
Are you disappointed that I turned up?
I only got one phone call and she said yes, and she's there.
So this is for the new volunteers. This is for you. I would like to thank you very much. Because we're actually looking forward to you, because these old volunteers, they are here to support you. They are here to support you.
Which one we went home? Old age.
The senior, let me just correct myself. The senior volunteers. Senior ones. I'm not saying old.
She just digging. Can I just say, we had a meeting in Salford on Monday. It was a consensus meeting for the BAME staff. Apparently Agnes is gone to Oldham, so I'm taking over the chairship because I was co-chairing. And one of the things people brought up is that they want to be exposed to what BAME staff are doing in community. So I've spoken about CAHN. So having spoken about CAHN, it just means that either maybe on one of our next meetings, somebody from CAHN is there. I mean, I know I do represent, but they also, when I'm there in the capacity of being a chair and the staff in Salford, but just serving that person. And then in October, I'm setting up to have functions every week. So I'd like CAHN to sort of have like an ongoing desk, because so more people, because that I think will get more people. Because it was them asking, and I said, well, there's something in place. So maybe that's an idea to say in other places as well.
Okay, that's good. So, okay, on this incident, since we're talking about the neighborhood leads, I know you are from Bolton, Southwood area.
Bolton, yeah.
I know you've got lots of roles and responsibility which you're doing at the moment.
What do you want leads to do? That's what people need to know.
Okay, for the lead person of that neighborhood, if there's a request which has been made for screening or for any promotion which is happening in that area, you will be like foreseeing that request, and then with the lead who will be allocated at that particular time. And the reason being that we just want people to be involved and then people to take part as well. Because sometimes people, they'll think that, oh, I'm just a piece of extra help, that kind of thing. We just want people to be more, how can I put it across?
Proactive.
Yeah, to be more active and to feel more responsible as well. Yeah,
because not just another WhatsApp.
not just an
where,
extra
just wait for the
person
odd
or an
message,
extra,
you know,
that even if I don't go,
active.
it doesn't matter, that kind of thing. Because if people are not allocated a responsibility, they'll feel that as if they're not being valued. That's the way they feel, as if they're not being valued. We are valuing everybody anyway, whether being new or old.
Thank you.
Or senior volunteers. We are valuing everyone. But then we just need to spread anyway the responsibilities and to make sure that people are being supported. Because we've been through COVID and you have seen the way how it has drained us. All the energies, they've dwindled. And some other people will be asking, how do you do it? And you don't know how you actually do it sometimes. So that's the reason why we just need that support. So for people who live in those areas, you would also communicate with the people in your area and mobilizing them as well to be part of CAHN and that kind of thing. So can we start with Bolton then?
Yes, Bolton is fine. I mean, I've got a church, our branch there, so
Okay.
it's my starting point.
So Bolton
we could arrange
is
something
Scholar
in my
then, yeah?
church.
Thank you very much, Scholar. Okay. We've got Old Trafford and Altrincham.
They're all on the.
They're all
Trafford.
under
Trafford.
Trafford services, isn't it? Is that yours, June?
We live near each other, so we'll do it joint. We'll do it joint. Yeah, we'll do it together because we live near each other.
There's someone else in Bolton with me, isn't it?
You're in Bolton, isn't it? So Alexandra, yes. At least if we put two people, Yeah, if we put two people, to be honest, it's less
sitting there quiet.
stressful.
Sandra, we can work together.
So and Alexandra, yeah?
Jilly, you're sitting there quiet. We know you're trapping too.
You'll be tapping into it. No,
I'd
so
like
she's
to,
supporting you as well. Is it Alexandra or
Alex, A-L-E-S-S.
L-A-L-E.
Double S.
Double S.
Yeah.
Alexandra. And then June and you just Trafford. I said all Trafford. You can say the Trafford. Yeah. June and you just. Yeah. Yeah.
It's Trafford only.
Which area, darling?
I'm just observing.
Kind of link, so you become a member, and then it's up to us to keep growing the membership and then trying to have that transition into what does that mean. That's the bit. No, I mean that's the bit where I think then when people are there, it's what we then do when they're there, really, isn't it? It's what the offer is for people who are members. What would it entail?
Right. So how about Central Manchester? Who lives in the central area?
Can they?
Yeah, the people in the back. I think.
But we've got people after.
After.
Yeah, I think it's too much to do.
Okay.
That's fine.
I'm just thinking what might help us, because this ad hoc meeting sometimes they.
So we've got me there, and then we've got Alexandra. Yeah, didn't John. Alexandra, cardiology, Esnat, pharmacy and education, Right, Paula King, mental health. Yeah, we've put yours. And then Yudia's case management. Is there any specialist area which you
Would you say, is that from community?
Yeah, community.
Okay.
community
Diabetes.
long term?
and
You long term
conditions.
conditions,
Yes,
Yudias. I can tell yours. Long term conditions, yeah. And Julie, which area, Julie?
Same.
Lady, long-term conditions as well?
Look, he's on that side. Look, John.
I'm trying to think your area of specialist.
I guess I've got a bit of long-term condition.
I know.
It's old.
So should we put you on long-term conditions then?
You can write that down if that helps you.
Yeah. Long-term conditions. Vanessa, orthopedic and trauma. And when we're talking about bones.
And ED as well.
And ED, yeah. Right. And Chaneka and Aleka, they didn't write. Somebody's in vascular.
Yes, surgery, gen surgery.
Whether it's a virtual talk, thank you, Maria. A virtual talk, that virtual talk, it needs to be talking to the public, for the public to support students whom they are living with at home. Because students, they are stressed with a lot of things, whatever is happening at home, and it affects their college work, and it affects their placements as well. So they need that support at home as well. So any profession is actually very required within the CAHN organization, be it other healthcare professionals, which are the allied healthcare professionals. We've got the pharmacist here already, and then social work, unfortunately, she's been bereaved. She was going to be here, and she actually took it on board with the way how I explained it to her. She was saying, when I was talking to her as a social worker, she was saying, how can a social worker be part of CAHN? I said, you know what, when we are doing these events or these talks, we need you to come and explain simple things to people, what they would expect of, especially like when they start looking for care homes, how the funding is sourced and things like that. What people need to be told is just simple jargon, not all these other jargons which they are being told when things are happening, when they are deteriorating and in the hospital. So that's the reason why we need everybody to be on board. As Kumbuzo, that's our
children, mental health children.
Mental health children.
To leaders. So I guess my question would be is, there is like the here and now of the stuff, the provision that the offer is, but then what would the future look like, and how do you work with the other volunteers that within CAHN and grow it? Because at the moment it might seem too complex to join, and you've already said people might not know what they might want to do. So I guess that would be my question as well. Is there an opportunity there to work with the health MDT along with the other volunteers and draw in new volunteers? Does that make sense?
Yeah, I can pose that one too.
That would just be a question.
Sorry, can I add to that question and say, for those people that are volunteering, it's usually because they're really motivated. But I think there's, whilst the main focus is to help the black community, I think there's a lot of benefit from being a member, and those benefits need to be highlighted.
Yes.
And there's advantages to people just being
Being a
members of
member.
CAHN that need to be made explicit to them. Into things that they could benefit from learning from other healthcare professionals, career progression,
Absolutely.
social responsibility. There's so many different things, but they kind of maybe need to be made clear, and then that's more of an incentive for them to join.
Yeah, definitely, I do agree with you, Esnat, on that one. And then with the benefits side, I know we've been working with other healthcare professionals, different organizations, and we've been supporting each other amongst the group anyway. And it's been a blessing that we've got another BME group as well, which we link into as well, supporting each other from those two groups, being a member of CAHN and being a member of the BME group as well. And then on the voluntary on its own, we've already discussed this. I think if you can read our terms of references, I did post them on the group chat as well. I don't know whether we've managed to read them, all of us. I'm just saying we as CAHN now, because we are the CAHN people. The expenses on traveling, they are going to be reimbursed anyway for those who are traveling to do the screening. And I know previously we've just been going out, and then I know Faye has been telling us to submit our mileage. Personally, I've been with CAHN 5 years, or more than 5 years. I've been saying, oh, I'll post my mileage, I'll post my mileage. I think that needs to be looked into as well, because we need to encourage people that even if you go and volunteer, you're going to be reimbursed your mileage. And then I'll check with Faye and Charles that as soon as the volunteer comes in to volunteer, that's the reason why we need leads now for each screening, because that lead will be taking charge and responsibility of the equipment which is going to be used on that day, and then mileage forms for the staff, whether there are 4 staff who are allocated for that particular screening. You'll be given your mileage form to fill in, whether it's going to be electronic, it can be sent to your email, and then you fill it in, and then you submit it, and then you get your mileage money refunded. And then for your CPD as well, the time which you have actually volunteered, it can be included for your CPD. I think for nurses, I know it can be used as well for your hours when you're doing your revalidation. I'm not quite sure about the AHPs, how you do your registration and your CPD hours as well, whether you need those hours as well. So that can be included as well on your hours for your renewal of your registration. And then for career development, we've got senior nurses starting from band 8C. I think we've got even senior staff within the team, to student nurses. So you can imagine, we had a student nurse who has just been referred to by Laurenti, who was looking after a retired nurse. Checking if they were okay. So that was actually very kind of her to do that as well. So those are the professionals which are within the team as well. So the support is there, to be honest. It's a matter of being visible. So we just want to be visible and approachable as well, because there are some other people, you can imagine, I wouldn't want to feel bad to come and approach you if I've got any problem. I know I've been communicating with you when I wanted some support with my prescribing, because I knew we had a pharmacist within the CAHN group, and I knew you through CAHN, and now the way how we communicate, it seems as if we've met somewhere else besides CAHN. So these are the other benefits which are already there in CAHN. So I don't know whether I've missed any other benefits, Faye.
There are so many benefits, but I can't look at time.
Yeah.
So we will share more, because we've got to talk about CPD as well in terms of credits, the programs, but we can do that another time. So thank you, and I want to hand over to Charles just to close up, if that's okay. But from me, thank you everybody for coming, and thanks for being committed to CAHN and the work of CAHN. We are CAHN, like you have said.
I'm following G, so I've done some notes. But I think, first and foremost, just say massive thanks, to you all, and for the difference you've made to the community, the organization, and where we are. It's brilliant to have seen so many of you giving your time, doing the screening pre-pandemic, and what we've been able to do during the pandemic, taking it online. And even the CATIP, we call it CATIP now, the Caribbean African Targeted Health Improvement Program. But it's been an amazing journey. You've made so much difference. to the organization, and it's been incredible. So whether it's the hot chocolate Julie paid for at Passwood Road, and bringing along, a couple of nurses from MFT to support with the Windrush, and we're really delighted that we have, 2 qualified nurses, who now work. They used to be volunteers back then. They're still working. Who knows? Maybe in 3 years we might be running some of the health and social care settings. We might be running some, and yes, but it's been, why not? I think the screening has made a lot of difference, and Esna talking about medication and people who weren't taking their tablets, going back and then taking those medication, and the difference that has made. But also our learning environment, giving young student nurses, not necessarily from our community, an opportunity to really understand some of the challenges when it comes to health inequalities and the challenge that Caribbean African people have. So thank you for giving your time, signing off and supporting, and we hope to do a lot more. All of you can tell we're really ambitious, and at the moment we're not just working in Greater Manchester, but working in Birmingham, Nottingham, Leicester. We're having conversations, London, Frimley, Lancashire and South Cumbria. So we're really looking forward to you using your networks to recruit people who are outside, so that some of the other areas could benefit as well. And I remember this phraseology, but also talking about the Saturday morning sessions. I know there have been times Vanessa has come in, to support some of what the doctors or consultants are talking about. And we want a lot more of you. One of the things we want to organize, if it's even periodic sessions on Know Your Numbers, and just breaking things down for people and really talking them through, that will make an awful lot of difference as well. But this year we were also really delighted after last year having presented to some of the policymakers at Department of Health and Social Care, for us to have been asked to host the first National Black CVD Advisory Group that Faye kindly, chaired. So it's real progress and a lot of things in the pipeline following that. But we couldn't have run the vaccines clinic last July without yourselves. What we have done, because there are lots of black-led organizations, and Paula will tell you what has been different with CAHN is access to assets like yourselves, champions and people willing to give you, as well as our medical doctors. And I think that's making a real difference. So we're hoping that in going forward, you continue to support what we do. Like Tembi was talking about the Saturday morning sessions. We want to see more of our nurses on there. We're hoping if it's weekday evenings, that would be better. Occasionally, probably once a month, because I know Faye's been a nurse, once a nurse, always a nurse. Championing that so people can interact. But I'm always thinking about Vanessa talking a couple of times on the health hour about advocacy and having a bank of nurses that will accompany some of our older people to appointments, because knowing the right questions to ask could make a real difference. So all these opportunities and ideas are there within CAHN. And when many of you started volunteering, we used to have just Lorraine, and we were based over there. At the start of the pandemic, we had 3 part-time staff doing sort of 2-3 days. Now we have over 45. Wow. Yes. But and people from different nationalities, and some live in Birmingham, London, Southend, and other places. So it's really interesting, but it's for us the response, and that is why we're excited to have the health space for the Caribbean Carnival, the 50th anniversary, 50 years of having the carnival every year. And we're going to have the health space, and we're hoping to screen. So we've been, I'm looking forward to the, CAHN Health Passport and how we can invest and really develop that, and the link to social prescribing and personalized care. But also we've been thinking about what can we give back. And I know you've talked about CPD, but Also, for those who are interested in getting into management, any support we could offer with pre-application support, mock interviews, but also even coming to shadow, because I've sat on a number of panels recruiting, privileged to be one of the governors at Manchester Foundation Trust and a couple of other things. And sometimes it's about the policy bit. That's where our people fall short. I remember in December, just before Christmas, being on a panel, and we're recruiting for, sickle cell band 6 nurse, and someone from our community who was a hematology nurse, couldn't really translate that experience and, really sell herself. And we ended up appointing a white, health security or whatever you call that person who has, and you would have thought the person with hematology experience would be far ahead. So that comfort, anything we can do to support, finance and managing budgets, I know they're also crucial. So any opportunity, anything we can do to support within the CAHN environment, as well, you'll be more than welcome. But there are various programs we're running, called 20+5, which is a national initiative. But also we have Faye on the NCA board, on Chester as well. So any aspirations you have, Udis and I, we met at a Health Inequalities conference. Even if you want to go to some of these national events and speak on behalf of CAHN and what we do, we will make sure expenses are sorted. We will email, the various steps and procedures and make sure that, those expenses are reimbursed. But the experience is here as well, and how we make sure that our younger people growing up as well. Paula, we're privileged to have had your daughter as one of the first to represent our community on the Youth Combined Authority. So what can we do for our young people? As yourselves, you have lots of experience. So even in CAHN, we have an ideas box. So any ideas you have that can help our community, please don't sit on it. If it means we have to find funding somewhere, Julie will tell you, we can knock on doors and we can cajole and, but also there are relationships. If you want shadowing opportunities, once again, we can knock on doors with the new ICS and all that. But so please don't, hold back any career aspirations you have, whatever we can do to support. And I know, Paula, you've been running your, new organization, Fikeweli. We've had conversations as well, whether you're thinking of doing something overseas or here, whatever we can do to support. We want to be a generous, organization, and, Lorenta will tell you, June will tell you, because they're inside, they see that. Whatever we can do to help, we will. So I just want to wrap up saying massive thanks. Let's stay on this journey. What will be amazing is in 20 years' time, our people are living healthier, they're living longer, they're able to articulate clearly, their rights when it comes to accessing cares. Their health outcomes has improved, and they're having their medication because they're not listening to any myths. Many of you have done so much during the pandemic, and we can't thank you enough. We wish we could have supported a lot more, but we have a counselling service as well. It's Black-led. Paula's mom was one of the key people who were at the beginning, but some of you have had your own personal experiences during the pandemic as well. So anything we can do to support, the Black-led counselling service is there. Fikeweli, Paula is working on other things. So anything we can do to support, please don't hold back. We will be willing to talk, because we're not just about taking, but we want to be able to give back as well. So I'll just end by saying massive thanks for all you've done in the last 5 years, both to the old and the new. And we look forward to another 5 years where we will be celebrating. So the gala is coming up. We will make sure that on the 22nd of October, you wouldn't be screening on that evening. Yes, 500 people packed in the Hilton. We want to make sure all of you are able to. So please don't take a shift just for that day, so that you can have some fun. We love seeing in the long dresses and the glitters and stuff, just so you can put your feet up as well. So massive thanks for all you do. And we will keep in touch.
Thank you very much, everybody, for coming, and I think that's us. We will be communicating via our forum as usual and keeping you updated. And I know Laurenti wants some volunteers for this coming Sunday.
Yeah, please, it would be great. Need 4. Lovely, thank you, we've got 1. So if anyone else, that would be great. Great.
What time?
Well, it'd be from 1 o'clock really, wouldn't it? Unless you want to attend the service, which is from 10 till...
They train for organising the catering, which was amazing. Please do that to your family members.
Thank you very much. We've got a late comer. Doris, introduce yourself in your area of work.
I'm so sorry. I just had a little nap. I'm so sorry. My name is Doris. I'm an ACP from Crisis Response Service.
Thanks for coming, Doris. She sent me a text message. Oh, just woke up and said, get yourself here. That's what they said.
Are you having a group photo, please?
I left this photograph with my church t-shirt.
And I'm seeing her on Monday, so it's
That's always working here.
Come on, let's take pictures.
And you want chicken breast? Right, this, at the end on that is the jerk actual, you got a whole breast? At the end is the actual jerk sauce, so if you want to put more jerk sauce on, you can do. Is that enough?
Very nice, I think.
What would you like? Some of the chickpea curry? It's plantain and chickpea with spinach.
Wow. Wow. Okay, that's going to be tasty.
Anything else?
I wish I'd have some.
Curry go?
Yes,
Have a taste of everything because you'll enjoy it. I am biased because my sister made it for me.
try a little bit of
Plantain curry. Got enough?
Thank you.
Is there anything I can help you? That's spinach rice.
Please.
Eh?
For just $67, you can make as many videos as you want and you never need to pick up a camera or use any fancy editing software. With doodling, you drag, you drop, you tweak some sound.